Welcome everyone, I'm Casey Peluso from Parkinson Foundation, Western Pennsylvania, and I am joined by our Executive Director and CEO, Christine Haythorne. She's waving, as well as Program Director and longest standing member of PFWPA, David Von Hoven. And Emily is working in the background, our fourth worker employee. I'm really excited about today's presentation on music and movement, music therapy and movement, especially since it's geared to neurological disorders. And we're really honored to have Lake Erie Music Therapy be the presenter of this program. And we have a wonderful board certified music therapist that will be sharing details about this wonderful therapy and a program that we'll be offering virtually. Brittany Barko Krugger is a neurologic music therapist and a multi-instrumentalist. She's native to Erie and was the first graduate of the Mercyhurst Music Therapy program in 2013. She completed her internship at University Hospital's Case Medical Center in Cleveland, Ohio, where she gained clinical experience in oncology, hospice, at-risk preschoolers, sickle cell disease, and medical surgical populations. Brittany completed her graduate studies at Western Michigan University in music therapy, where she gained invaluable research experience and further developed her clinical skills in neurologic rehabilitation. And Brittany's favorite part of going to work is the look on clients' faces when they realize they have accomplished something new through music therapy. So this is going to be, I think, a really worthwhile and enlightening program. And I will now hand it over to Brittany, our presenter.
Thanks, Casey.
You're welcome.
Oh, wow. If you can hear me, can you give me a thumbs up on your screen? I'm going to just play with what I see. Okay. Technology is great, huh? Boy, if anything, the past few months have showed us that anything is possible if we just play around until it works, right? Great. Welcome. I see like half your faces. I see black screens. Hopefully you can see mine and hear me okay. It's a delight to be here too. Thank you, Casey and David, for having me. I was explaining to my intern earlier that sometimes when I speak on this, I only have 15 minutes and I feel like I'm rushed and I never know what's most important. So that to have the space to really explain and to get your feedback and show you actually what a cool job I have and how it applies to real life in really beautiful and tangible ways, it's just nice to have space. So I just wanted to acknowledge that. I have a PowerPoint. I'm a visual learner. So for those of us who are visual learners as well, just some pictures. I'm going to describe a little bit of what I do specific to individuals with motor needs and speech needs that are common in those with the diagnosis of Parkinson's. There's a couple times where I'll show some videos of music therapy in action, and I'll be interested to see what you think or what might be confusing, or if you have questions on that. So that'll be one time where I'll just stop and we can unmute ourselves and kind of catch up. There's another part that towards the end, I'm going to ask us to sing. So I will sing on my, unmuted self. And because there's always an audio delay, we'll stay muted, but I think you can still experience the mock session, if you will. And then at the end, we'll just also open it up for questions. I think we could also use the chat if you think of something while I'm rambling and telling you about all the cool music things in the brain. If you think of something, throw it in the chat. I will try to monitor that as well. maybe Casey and David, if I skip something, just say hey. So with that, maybe I'll just tell you a little bit more about myself. I'm currently sitting in Encompass Rehabilitation Hospital in Erie. And I contract here 6 hours a week through the private practice. And I see a mix of patients with neurologic needs. And I find a lot of patients with a Parkinson's diagnosis. I'm working on things like making bigger movements or regulating a walking speed to be safe and efficient, or singing with someone whose voice because of Parkinson's has become quiet and raspy, to sing with a full voice to help on things like swallowing and vocal volume, which a speech therapist would work at. So if you hear like the intercom going off, that's because that's where I'm on, but we'll just go with the flow. So what else should you know? I work at Mercyhurst University. That's our little liberal arts college in Erie, where we have a music therapy program, and we intern with students there too.
Hello. Yes.
Do I hear something funny? All right. Here comes the PowerPoint. If you can see a brain with music notes on it, can I have a thumbs up? Just want to make sure you're seeing what I see. Thank you, Deborah. Great. Thank you to our sponsors. Wow, what an idea of sponsors. Community involvement. I love it. Thank you, Debbie, for the thumbs up. Okay, we're going to dive in. Here we go. So music therapy is an interesting field that actually got started as a profession, was codified as such when soldiers were coming back from the war and had a lot of pain needs. Nurses who were overworked and understaffed were actually finding that music making or even listening to music had similar effects to the high pain medications that people were on. And so it began developing as this idea that something that is so mainstream to our everyday lives could be used in a healthcare setting. So research started being done. Training became possible for, what is a music therapist and what differentiates that person from the coffee bar singer, on your Friday night open mic. And we found that a lot of what's important in any facet of what we do is understanding how does our brain work for any task at all, and then also how is music processed in the brain. And I kind of just like to illustrate this to show when we do a music therapy intervention, we're thinking about how can we best serve a healthcare need. We have to look at how is it processed in the brain. So specifically for Parkinson's, perhaps you've heard a million times by now that one of the main traits in how Parkinson's manifests is a lack of dopamine, which is a neurotransmitter in our brain that regulates our mood, that helps us with...
Madeline Cabani, 1366. Madeline, please call 1366.
There we go. That helps with not only regulating our movement, but telling us how to move and when to move. I like this illustration because it shows, here's our motor cortex right here in that dark blue. Primarily when we hear music, when we hear an auditory stimulus, that's processed by the temporal lobe on both sides of our brain. What's interesting is you'll notice that there's an intersection here where the temporal lobe is kind of sharing some real estate with not only the motor cortex, but how we feel and we experience our sensory input. And we find that if we're hearing a particular pulse, a little rhythm like this, if you stick someone's brain on a scan, you'll see that at the same speed that this snap is snapping, neurons will be firing in this pink section, in this temporal lobe, because as it's being processed, it's also kind of expecting what is next. What's interesting is not only are they firing in the temporal lobe, but they also, in this shared real estate, are firing in the motor cortex as well, which is what we find when we're moving to music. If someone else is keeping a beat for us, we can also move at that speed too, which transfers to all sorts of different music therapy applications that I'll kind of explain in a little more detail. So it's finding how does the brain work for a non-music task, like walking or speaking or feeling, and letting that coincide with how do we experience music. I also like to use the example, often if someone has experienced a stroke, the majority of them happen on the left side of the brain. I like this illustration because for most of us, left brain is about order and language and staying pragmatic. Our right brain is where we're creative, where we are emotional in the very most general sense, right? There's no absolutes in this life. But we find that even if a part in our left brain where speech is housed is damaged, music making is a full brain experience. Despite the Middle Age theory that there is one music center and there is one emotional center in our brain, we find that music happens everywhere, particularly when we're making it. When we're making it, we're moving, we're listening, we're responding, we might even be vocalizing ourselves. And so even if a part of the left brain is damaged, say in a stroke setting where you know what you want to say, but it's just not coming out, we often find that patients can still sing their favorite "You Are My Sunshine" in full sentences, with full clarity, with a smile on their face. You know, mind you, music making is intended to be pleasurable and familiar and grounding. So we find that it's not that something else is replacing the left brain, but because music is a full brain experience, it's helping reroute maybe a roadblock. I'm going to check the chat. There's so many windows. Great. So next I'm going to just move into some examples about specific music therapy interventions to be used in 4 different avenues. We'll start with physical therapy, then we'll move to occupational therapy, then to speech, and then lastly, psychosocial sort of domains. The beautiful part about how music therapy operates is that it can switch hats. I work with kids on the autism spectrum where we're working on things like emotional regulation or expressive language, but I also can switch a hat and be this lady with an auto harp. Anyone familiar with an auto harp? It's not as popular these days. I usually use a guitar to help this gentleman walk down the hall with safe steps, with long steps. so that the music making is the last step of the process. We find what's the healthcare goal.
Case management, 1366. Chris, 1366.
And then we find a way to make music doing it. So here's the first example. So rhythmic auditory stimulation is a very fancy way to say walking or moving to a beat. There's a word that we use sometimes called entrainment. Oh, not there. There we go. Entrainment is the idea that when you're at a concert and the singer starts clapping for you, that you're going to clap along at the same speed. This idea that you have something external, that it's not inside of you, and that you are moving and maybe singing along at that same speed. So entrainment works in that, let's say a gentleman needs to walk into his kitchen from his living room, and because he's not receiving enough dopamine, his steps are very quick and he's standing on his toes. And so when he walks, he is shuffling super fast. So maybe if I was going to put a beat to this gentleman's cadence, I'll use these words here, how fast is he walking? It might sound like this. That's a pretty quick click. We find though that usually when you're walking that fast, and particularly if he is shuffling like that, there's a greater risk of falls. So in a setting like this, what might happen is in his home or in a physical therapy setting, I would take a live guitar or maybe a drum beat or something that I could move with and just watch him walk. I would find his speed and then I would match it. I'm going to match and I'm going to meet him where he's at. And so this brain that's not consciously realizing that, oh, there's music going on, there's an external stimulus happening at the same rate that I'm moving. What's really interesting is we find that even a non-musician brain, if I'm playing the guitar at that speed, down, up, down, up, down, up, strum, 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 if I slowly start to slow down, which is essentially what we would want this gentleman to do to have safer, bigger steps, in time, that brain would entrain so that his steps would slow down as well. Why? Because that external cue that he's getting in this pink section that I'm changing is going to change how fast he's going to move in a motor setting. It kind of seems like magic once in a while, but it's a lot of back and forth, and it happens live with a lot of training. So what's beautiful about this is that it once the therapist and the patient can understand how each other works and what to listen for, and I will, often walk with someone backwards in a hallway to show, left, right, strumming my guitar so that it's very predictable that we're going to be gaining new motor patterns. So that gentleman's not only going to slow down, but we're also going to find that with more time, it's really important in a physical therapy setting to have heel strike. I don't know what you can see of me. Here we go. So if this is the floor and this is the foot, walking on our toes, we have a greater risk of falling. But when we're slower, we get to strike that heel, which is extremely important in diminishing the risk of falls, all because you're just walking to a beat. We find often in a program like this, where maybe 3 or 4 times a week on average, that once this is established and we've kind of found that sweet spot of what's a good speed for Joe, what are good tactile and visual and auditory cues for Joe who has gait training needs, that there's about an 8-week carryover of post-treatment effects on these gait traits before you would need a brush-up course. Of course, everybody's different, So I'm just giving averages. Next, I want to show you a little video of what this might look like. It's an extreme, beautiful scenario that you hope happens in the real world all the time, but it's a good example. So I'll let this play and then we'll stop and unmute for questions.
Smiling.
Yeah, almost there, you know, without a cane.
So quick note, when it says walk in tempo, that's what I was referring to about entrainment. He is able, when he hears a certain beat, to then follow that with the speed in which he walks. It's important to know if that's even possible before you progress.
Respiratory 1, 2, 4, 3. Respiratory, please.
So interesting. I'll turn this off for a second so I can see our faces. Any comments or questions, observations? Are metronomes as effective as actual music in maintaining cadence after therapy? In my humble experience of 6 years, I would say yes. It's just a matter of knowing how to use them. Sometimes it's really important when learning how to walk to a metronome, which is not something we're taught how to do. I first, when I use a metronome and I'll just stick a big speaker on my chest, then I would say, left, right, to know how, I don't know, giving directions, verbal cues. But I would say yes, the metronome, which, a simple click that you can download an app on your phone and it'll play a drum beat for you, is just as effective as me playing a guitar. Because in this particular setting, in a physical therapy setting, rhythm of all the components of music are most important, because we're changing the pace. Sometimes if I have someone who needs a little more pep in their step than just a drum beat, I might take that speed that we're working with and sing along to their favorite Eagles song. So I'm adding a different component, which makes it familiar. It also gives me, oh, I have to walk until this song is over. And so emotional, motivational component. But to answer David's question, I would say yes. In a rhythmic auditory stimulation setting, rhythm, whether it's a metronome or say a guitar or a piano or something, is getting at the same thing. Can music therapy help prevent movement problems? That's broad. So I'll speak to what I've seen at Encompass. Movement problems, you always have to look at like the source. You know, is it a physical muscular injury? Is it a neurologic deficit? And I think there's limitations and benefits to both, I would say. I think in an orthopedic setting, my mom just got her knee replaced. So her movement needs are not neurologic, they are purely orthopedic. And she loves like Pat Benatar and Heart. That's what motivates her. That's what she grew up listening to. And so she uses music as a motivational tool to do her physical therapy exercises. We learn how to move at a rate that's not painful for her, but still yet effective and motivational. I would say in my next slide, I'm going to talk about occupational therapy applications, which will get a little bit more at Laura's question about how to encourage big movements and just to recalibrate so that the progression doesn't get worse. The more you move, the better you're going to stay. Let's see. Yeah, that's an interesting one, Anne. I spoke about a lot. Anna's speaking about imagining yourself doing a movement activated the same brain area as doing it. Just as, let's see if I can put this back up. Nope. There we go. Just as if we're visualizing it back here. Okay, I'm not frozen anymore. I would say yes. The brain is a mystery, right? But I know a lot in a lot of my voice training. Some of my practice would be all in my head because moving or singing is very physical. And so some of those connections which happen in these intersections are still activated. Thank you, Anne. Oh. Can you all still hear me? Thank you, Linda. Zoom is telling me funny things. Thank you, David. Thank you, Ed. Okay, onward. So the first one was physical therapy-esque. Let's move to an occupational therapy setting. Oh, my laptop's doing funny things. Can we all see a gentleman with his arms out? Thank you, Casey. So let's move to other domains that are important from a movement perspective. A lack of dopamine in our brain tells us that we can shrivel up into this little ball where we barely need to move, and that we don't have much. Sometimes the effort to do anything is really diminished. And so a motto for combating movement problems down the road is just thinking big, thinking expanded, thinking amplified, and using the qualities of music, whether you give a contrast of big and loud, or I'm going to strum my guitar really big, is emulating what we need to do with our bodies when we reach up for that cup at the top of the shelf, or when we reach down to pick up something off the floor. We have to almost recalibrate ourselves to tell us, I need a lot of effort. I only have a certain amount of time to get from A to B down on the floor. And I need to do that safely and balanced. So often when I co-treat with an occupational therapist, I'm doing a lot more music making, where let's say, I'm going to make myself bigger here. Let's say we're working on reaching, getting our arms to be out nice and big. You could work on this by taking some, weights and going, out and in, out and in, sort of like this. Another way to do that using a rhythm component is that I have two big drums. They look like frying pans, honestly. And what I will do is I will have them suspended in places where they're just out of reach. Just, you can tap them with the drumstick. And let's say somebody likes the Eagles. A lot of people like the Eagles and Compass Health for some reason. So I will find a preferred song. I will find a beat that is appropriate for a patient to go back and forth and back and forth and back. So a lot of things are happening here. Here I'm, playing guitar, same idea of there's a beat that someone can follow. With that beat to follow, it's predictable, it's easy, no music experience required, but it's also giving that brain a priming cue that I don't have much time for my movements to be spastic or frozen, because I only have a certain amount of time that I'm hearing externally to go from A to B, from A to B. So what's nice about that in a live setting is that I can adjust the drums to be, close in, or maybe they're at different levels so that we can work on balance needs, and all while you're just jamming to your favorite Eagles song. It's interesting is in a collaborative experience like that, where I make it easy but fun, but also goal-oriented, you don't feel like you're working that hard until the 3-minute song is done and you've been standing for 3 minutes and you just sang the whole Take It Easy while you're hitting some drums. So there's a lot of beauty and science all wrapped into one. Another thing I did, particularly in my thesis when I was in Michigan, is anyone familiar with the BIG program? Show of hands. Things are changing and evolving all the time. And what I found there is there's a certain set of exercises that are evidence-based and working on the same goals of moving big, moving efficiently, is that I created music that emulates each of those. There's particularly one, I think it's like the first one in the bit, where you have to hold your arms out for 10 counts with big live hands. Live hands is a big thing. And you know what everybody does when they want to count to 10? They go real fast. They go like this: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, which is not effective or beneficial in a therapeutic setting. So what do? I have a drum beat that counts to 10 for you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then there's a big slap at the end. I remember that. And when I built this music, I built that in so not only would it give you a time that you really have to hold your arms out there so that you're not cheating, but you also can just focus on your movements instead of being like, oh no, what rep am I on? Did I do this 6 times or am I on number 4? So a lot of different applications. I think of everything I've said so far will be most similar to what we're going to be offering in September. This little virtual experience. I could talk all day, but I think I'll keep going so we could have question time. So we did physical. I spoke a little bit about occupational, and now in my rehab mind, we'll move to music used in a speech therapy setting, where particular goals would be vocal volume, so that we don't have to keep chewing our cabbage twice. That same lack of dopamine that might not let us stretch far enough is affecting our vocal cords, that those muscles might get weak, not only from a speaking perspective, from a swallowing perspective as well. And those are the things that if you don't start working on them actively, because of the progressive nature of Parkinson's, there's a greater chance of decline. Let's just be real. So if you come at them from a place of I'm going to keep these muscles strong, sometimes singing is a really effective way to do that. So things like vocal volume, but also articulation. The same part that helps us to move efficiently when we're hitting the drum is helping our mouths to move, to say all of our T's and F's and B's, because this is speaking itself is a motor movement. What else? Oh, just the simple fact that like singing is good for the soul, right? I'm a huge proponent of finding music that is preferred. So today I sang rap, I sang Johnny Cash, I'll sing pop music. A lot of people like the Eagles here, Patsy Cline, because I think it's super important to find things that we know. So it's not like, oh, this person's singing at me and I'm in a hospital and I don't know the words to this. So I think it's really important to find things that are preferred and predictable. So I thought I'd give you some examples. Show of hands if you know some of these. My Bonnie lies over the ocean. My Bonnie lies over the sea. You know what? If we're all muted, let's sing this. And I'll show you the difference of like, if you put this on the radio, it might be pretty fast. It might be pretty high. Not many of us are high singers. I'm gonna grab my guitar because I can. So let's stay muted and feel free to sing with me. I'm gonna make sure that, whoop. Here's my guitar. Okay, why not, right? We're talking about music, we might as well make it. I'll start, and once you know it, sing along, but we can't hear you anyways, so there's nothing to be embarrassed about. I'll start like this. My Bonnie lies over the ocean. My Bonnie lies over the sea. Thank you, Judy. My Bonnie lies over the ocean. Oh, bring back my Bonnie to me. Here comes the bring backs. Bring back The only thing about Zoom is that there's this audio delay, right? So if we were all unmuted, that we would have sounded like a, corral of cats or something. But so what's interesting about something like that is most of us knew it. It was simple, it was repetitive, and it was slow. So that we could work on things like taking a big breath before bring back. Because in a speech therapy setting, you want your vocalizations to be full and loud and well supported. And all of that is just built in to singing My Bonnie Lies Over the Ocean. Thank you. Some other examples. Can't Help Falling in Love with You. A lot of Elvis fans out there. I like this one because it has long phrases. You have to take a really deep breath before you sing, for I can't help falling in love with you. And if you can't make it, we'll stop live in real time and say, you ran out of breath before you said the word with you. So we practice breathing in real time. Thank you for singing, Judy. For some reason, I can see your face. So thank you. Just some other examples to get you thinking. The Banana Boat song is the one that starts off, Day-o, day-o, right? Easy, fun, mindless, so that all you have to focus on is singing day-o really loud and moving your tongue and your teeth and your lips to go, day-o. Ed, thanks for the question about playing an instrument. I've got a video to show, and then we'll bring that up. Thank you. Quickly, before I show that video, now that I've got you thinking about familiar, easy songs, do any of you have any other ideas that you could unmute yourself and share? What's a song that you love that's really easy that might work for someone who needs to just practice big, loud vocalizations? Hi, Dan.
Hello. I don't know whether I'm supposed to unmute that or not. Am I going to sing?
Can you think of another song maybe?
Oh, no.
Isn't it hard when you're on the spot?
Yes, it is.
So hard.
Another, you know what happened? I'm really nervous now because the words to the song that we were going to practice are gone.
Oh, no, that's fine.
Well, we know other songs. I can't think of them.
No. Let's get muted.
Oh, thank you, Karen. Joy to the world, all the boys and girls. That's a good one.
Yeah.
Fishes in the deep blue sea. Talk about articulation, right? Joy for you and me. Let it be. Thank you, Ed. Man, I can't tell you how many times when I don't know anything about anyone, I start with Let It Be and it's usually a hit. It's slow, it's repetitive, it's predictable, and most people like the Beatles, you know? Nice. And I've been working on the railroad. Yes. Yes. King of the Road. Oh, I forgot about that one. Trailer for sale or rent. Rooms to let 50 cents. Hey, you know what that's good for too? I forgot to mention. Sometimes I find in a speech therapy setting that we might talk monotone like this and we're all on one pitch. So singing naturally allows us to, like somewhere over the rainbow. It's built in. Caroline. Thank you. Cool. Okay, let's move to a video, which is a nice summary. Then we'll go to Ed's question and then open the whole floor for questions.
I'm Chris Romeo. I am a facilitator for Creative Leaps. I am so fortunate to be able to do music therapy here at the Parkinson Place. I love getting to work with their voice. Being an opera singer for the past 10 years, it is very rewarding to get to help people maintain their voice and even get function back in their voice to allow to express themselves, to regulate their breath, to understand how to use their breath if they need to call for help. It's just a very rewarding job, and I love to get to work with them. With Parkinson patients, it's important to continuously keep up with their physical exercise, and music just makes it fun, interesting, and helps keep a consistent rhythmic component to those exercises. It just makes it so much easier to achieve their goals. So with music therapy, we get to utilize all fun and interesting instruments, from flutes, violins, pianos, guitars, instruments that the therapists might utilize to help the client facilitate an exercise, but also instruments that the patient gets to use to partake in the exercise. Things like percussion instruments that we put on the ground and above them so we can work our lower back. We can put instruments on the sides of our patients so we can work our core strength and turning. We do a lot of speech and language. We use vocal techniques to help preserve their voice, help strengthen their voice. Music is a great tool to engage patients.
Any questions there? Any comments? You can either put it in the chat or unmute yourself. I like that. It's just a nice summary. I can talk about it all day, but until you see it, I think that's a good way to bring it home. One thing that's nice about this video that perhaps I forgot to highlight earlier is that music making is also a social activity, whether it's with other patients or just with the therapist. There's a lot of good that can come with communicating and making music with another person. There's a lot of mood and mental components of how we move, how we think, and how we're motivated. And sometimes I forget about, it's important that we are a body, but we're also a soul. We have needs, we have friends, we have likes and dislikes, and music making can tap into that as well. If I heard, and I'm going to date myself, but if I heard, music from the Backstreet Boys, which is what I listened to when I was a kid, that would remind me of my 10-year-old self. that would remind me, that would motivate me to get through a whole song. And if I get to share that with someone else, dopamine is going to be naturally flowing, even if that substantia nigra in the brain is having trouble producing it on its own. So I'm glad I thought of that in those 2 seconds to just remember that we are emotional beings as well. And then to speak of Ed's question, he asked about practicing an instrument, which is extremely, extremely helpful. I think it's important to know that sometimes you might have to modify how you play it. Musicians in a non-therapeutic setting can get so caught up in how to do it right, which is different than how to do it well. I have some patients that learned guitar before, but they don't have the same dexterity, and we can find different ways to do the same thing so that it's successful, even if it's not the same. Because music making in any form is beautiful. So thank you for that, Ed. David asked about co-treating, more or less. There's kind of a mix of that, and every region is a little different. When I'm at Encompass, I always co-treat, which means that a speech, occupational, or physical therapist is with me, so we're co-treating at the same time. We might be singing, but it's going to be billed to speech therapy because we're working on speech therapy goals. And another time, I might see a patient one-on-one in a clinic office. It's strictly music therapy and not a co-treat. But that's just a label that I would bill their insurance for other things. It would be labeled something different, even though the goals would be the same. I could talk all day, but
Hi, this is Steve Saxa.
Hi, Steve.
I have a karaoke machine that I haven't used very much, but I need to. It's something that you have the words listed, so you don't have to try to remember the words.
Yes.
The other thing is the speaking, I'm having trouble with maintaining the sound, but I can sing very loudly.
Yes.
But how do I convert that into the speaking? I mean,
Yeah, right. When does the karaoke transfer into talking with a guy across the street? I think of a lot of it is just like when you exercise physically, you need a lot of repetition. And some of that applies where if that's just part of your routine and you find a couple songs that are extremely easy and motivating for you, when you're breathing deep to sing those, it's going to naturally then transfer to your speaking because you're used to taking a deep breath before you talk. So I'd say the first step is just a healthy amount of repetition.
I have another question.
Yeah.
If you have a piano that's available and you don't know how to play, would you recommend trying to learn how to play piano?
Why not? Why not? But I think in introducing something like that, it might be best to connect yourself with a music person or a music therapist or some sort of online something that might teach you by ear first, so that you're still getting like the health benefit out of it, and so that you're not, like you said, you put the words in front of you so you don't have to think about it. So in a piano setting, which might seem really abstract and hard, I would approach it from a very simple place where you're learning to play some of those favorite songs that you're singing. So that your top priority in learning the piano is enjoyment and perhaps a fine motor task for you. Does that make sense?
Yes,
Yeah,
yes,
it's beautiful.
thank you.
Thank you, Steve. Thank you, Ed, about bar chords. Yeah, talk about finger strength, right? But there's cheater ways to play bar chords. I'm all about how can you be most successful? Maybe that means you modify it a little bit, but you're still making music at the end of the day. Thank you, David, talking about the harmonica. Yes. Both breathing in and breathing out. And then you get to like make a cool sound at the same time. It might be harder if you're just practicing that without an instrument, right? But when you have this tool, it's all built in.
Brittany,
Yes.
go ahead, Ron. You want me to say?
What,
This is Ron. Go ahead, Ron.
I've been, my elementary school teacher told me that I had no sense of rhythm whatsoever. And I'm now 75, almost 75 years old, and I still have no rhythm much. Sometimes I get in dancing fast with dancing fast. I can feel myself slip into a rhythm just for a short while, and then I think of it. I hear a rhythmic thing. So anyhow, 75 years old, can't rhythm compromised.
But we try to put on the music, Linda Ronstadt, and dance at least every Saturday. And he's very rhythmical during that, which he's kind of oblivious to, but I see it and it's wonderful.
Isn't it something? It happens sometimes unconsciously.
Yeah.
And so I think what's important, when you stick your Linda Ronstadt on, to find something that's slow enough so that it still is rhythmic. So you might not be dancing to every single beat of Linda, but you might be doing half speed so that it's predictable and you're just dancing.
Yeah.
Hey, Ron.
Yay.
Anything else as we're wrapping up here? Maybe I'll put my contact information on the screen in case you have follow-up.
And Brittany, do you mind sharing a little bit about the program that you'll be offering
Certainly.
to our folks?
Yeah.
Thanks.
I believe we're starting in September. We're working out some details there. And the idea there is finding a group of exercises that will be both beneficial to the whole. I'm going to do some homework regarding who we are, what we need, and sort of exercises that will most benefit us. And then I am going to create music that facilitates those. Not only will we be doing them together, despite that I will be on a screen, we'll be doing them together where I'll be giving you cues. And then the hope is that I will create a soundtrack that you can practice with at home when we're not meeting, I believe, once a week. So I would say a mix of occupational and physical therapy goals using music that is tailored for it.
Thanks. And we're proposing the Tuesdays from 11 a.m. to noon, starting September 7th. We'll have more information soon, and we'll get that to you all. Any other questions before Brittany departs?
Thank you.
You're cute.
Thank you.
Ron says Brittany's cute.
Thank you.
Okay, well, thank you so much, Brittany.
Yes.
Thank
Thank
you.
you all for attending, and we'll see you again soon.
Thank you all. Hey, we'll email.
Everyone try to sing a little bit today. Okay, bye everyone.
Bye.
Thanks all.
Bye.